Welcome to the Fit as a Mama Bear podcast. I'm Shelby, a certified strength coach, nutrition coach, mama to two, and all-around health nut. This show is about a little bit of everything healthy, fit, and natural related. So if you're striving to smash goals, eat better, feel better, and enjoy the occasional mom rant, this is the place for you. You're listening into episode 12 today, where I'm chatting with Victoria, also known as the elephant in the womb, about benefits of prenatal massage. So Victoria is a registered massage therapist, childbirth educator, and period coach who works local to me. It was a girlfriend who put us in touch, and I literally can't wait to delve into her brain. Welcome, Victoria. So thanks for jumping on with me today. I am super excited to chat about all things massage. I actually have a massage booked to Wednesday, and while I'm not pregnant, I feel this is just going to make me impatient waiting for it. Victoria, why don't you take a couple minutes to tell us a little bit about yourself and all of the things you do?
All right. So in 2016, I graduated from Fanshawe College with my advanced diploma in massage therapy, and pretty much right away knew that I wanted to work in the perinatal field. So my very first day on the job, my first client was a pregnant person, and coming out of school and not having any special training in it, I was kind of worried. But then I did it. Exactly. Oh, I literally went up to the clinic owner and was like, "What do I do?" And he's like, "You're self-employed. Figure it out."
Oh my God.
So that was scary, but it very quickly showed me how interesting it was and how much more I wanted to learn about it. And so as well, with growing up, my stepmom had 4 home births with my younger siblings.
Oh my goodness.
I know, she's a trooper.
That's impressive.
So I was always kind of exposed to the birth world and holistic care, and just being really involved, I guess, in pregnancy and birth and postpartum. And then you get older and you realize that not every pregnant person's journey has that care and focus. So once I found out that massage therapy could help that, I was all for it. And I was like, all right, what else can I learn? So just kind of always being exposed to the world of pregnancy. And then I moved to Windsor for a little bit and worked at a pregnancy clinic there and did my childbirth educator training and started teaching some prenatal classes and just kind of getting to massage people while also talking about pregnancy related things to help them feel more educated and secure was just working great. So I just kind of continued my education and learning, and I'm still constantly learning. But yeah, I definitely have a very women's health centered practice now.
So first off, the fact that you said you're still continuously learning is my favorite part about that story, because I think as coaches and anyone who helps any person, you have to continually learn. You can't just be done. There's always new things, evolving. So thank you. But please explain what a period coach is.
Yeah, this is a great question.
I love it.
So it's kind of hard to put into like a very quick sentence, but essentially my background was in childbirth education, and then I worked with the Red School through the UK and took courses in hormones, menstruation, menopause, kind of everything surrounding hormone harmony, and then channeled that into becoming a period coach. So there's not very many of us. There is a couple in Toronto. You've probably read some books by them maybe. And it's a little bit more common in like Australia and Europe. They're always ahead of the game, right? Yeah. So I basically work with people and their cycles to help with things like cramps, regulating it, people that are trying to conceive, talking about birth control, like kind of just everything uterus related. And I provide education and information to work with people and help them achieve where they want to get with their cycle.
Oh my God, I love that. Kudos to you. I didn't even know that overly existed, to be perfectly honest.
It's definitely newer, and I think it would probably grow in popularity as people learn it exists and time goes on, especially with the gaps in the education system. Like I think back to when I was in high school, I don't even think I knew what ovulation was until I was like 20 years old.
Yeah, agreed.
So as adults, I think it's important to have these resources and help each other and talk about the weird stuff that we just like Google at like midnight in our beds.
Oh my God, it's so true. That is amazing. Anything that kind of gets the discussion happening, I think is a good thing. Okay, so awesome. Today we are going to be focusing more on the prenatal massage aspect, but now I have a million questions about being a period coach. Now, I had massages through both of my pregnancies, mainly for postural stuff and because I was still working out. I did also have a please induce me labor massage.
Yes.
I did not know that those pressure points were all in your feet. Like that was completely mind-blowing to me. My RMT is awesome. She's sports specific, but she's also a doula, which is amazing for me because it kind of embraces the hippie side and the fitness freak in me. So with your schooling, obviously you're a registered massage therapist. And what additional things did you have to take to more focus on the prenatal form of massage? So you mentioned walking into your first massage for a pregnant lady being a little bit unprepared. And which understatement. What part of your training do you think was the most beneficial to prepare you to treat pregnant ladies?
I would actually say going and working at the pregnancy focused clinic in Windsor helped me the most.
Really?
I took, while I was there through the States, I took my infant massage instructor certification and prenatal courses. And while being in a classroom maybe is a good learning experience for some people, I had already known a lot of it from my childbirth educator training because we learned all about the anatomy and how to assist through births and everything. So I found most helpful sitting in on the other RMTs and chiropractors who worked on the pregnant people and just sitting in, being a fly on the wall and watching and listening to what they were doing. Maybe that's the way I learn, is like just being an observer and like being hands-on there and then being like, okay, feel this ligament here and what it's doing. So I definitely found that most beneficial. And those were practitioners that have been in the prenatal world for decades. So kind of feeding off their wealth of knowledge was very helpful, and just getting in there and being hands-on, because you can read as many books as you want, but when you're faced with the real deal, it's a lot different.
Oh, that's the way it is with training too, right? The theory only goes so far to dealing with everybody's individuality and having to kind of work around that.
Totally.
Now, is there an actual course specific to prenatal massage?
So with our regulatory body, they don't have a list of approved courses per se. It's kind of use your judgment and further your education wherever you would like to. So in school for registered massage therapy, we do go over pregnancy massage. I would say for us, it was about a 3-hour lecture and that was it.
Wow.
So everyone should come out of school equipped to treat a pregnant person. But not everybody comes out equipped with the extent of the knowledge of people who work with pregnant people often, if that makes sense, right?
No, it does. I think that's what freaks me out is it sounds terrible and I hate to make this jump, but it's like a general doctor giving out meal plans or nutrition advice. They study nutrition for what, like a millisecond in their entire medical career.
Yeah. And that's just it. That's like, if someone came to me and was wanting, like you, like sports massage, I would probably refer them out because that's not my wheelhouse, right? So, and it's like my coworkers, if they have someone who is interested in whether it's breast massage for mastitis or pregnancy or babies, they'll refer them to me. And I really think there's something important about knowing what you know and referring out when it's best to refer out.
And it sometimes is. Like it just genuinely is. I think the reason I asked the question is when I was pregnant, I was looking for an RMT for a pregnancy massage. And so I booked with one lady and I specifically asked if she directly billed insurance or if she should just give me the receipt. So I did it.
Right.
And her answer was, "Oh, I'm not registered that way." And I was like, so you're willing
Sounds
to work
sketchy.
on like you are marketing to pregnant ladies. That was specific, was prenatal massage, and you are not a registered RMT. Do you know the damage you can cause by manipulating someone's bodily systems while pregnant?
Yes, and that drives me
to be kidding me.
bonkers. Like there is a couple people like that within like a wide area, not just like London that I'm talking about, but within the community. We all get to know each other. And it definitely can be dangerous. The claims that I see that these people are making is very scary. I have heard of people who say, like not RMTs, but just like masseuses who say that they will correct the position of your uterus so that you
Oh my
can
God.
get pregnant, or people that say that that they can like induce labor, right? Like you said, like it's very much so being careful of your wording and your
Yeah.
knowledge. And that I've heard of, like, I don't even want to get into it, but there's people who are not RMTs that are saying they can do internal massage
Oh my
to,
God.
yeah, yeah, scary,
I was
scary
livid.
things.
And then my first question is, I was like, how many people don't ask if you're registered?
Yeah, or don't know, right? And
Yeah.
that's why I think it's really important to spread the knowledge of checking in with all your healthcare practitioners. So, chiropractors, massage therapists, physiotherapists, we're all regulated and registered. So you can go to, it's called CMTO, the College of Massage Therapists of Ontario. You can go to the website and there is a registry where you can look up anyone's name and make sure that they hold a valid RMT license, and you can see any dings on their license or charges that they've had. And I strongly recommend people do this. I know who your RMT is. She's clean. But
She's amazing.
you would be really surprised within London, some of the massage therapists and chiropractors that have a pretty lengthy list of slaps on the hands
I'm
from
totally going to Google this after we are done this podcast.
yes. So that would be my tip for people, is if you're seeing somebody advertising something, just go in, look it up, and see if they're actually registered and regulated, because there are people in town who offer prenatal massage that are not RMTs who have only taken a couple weekend courses
Oh my God.
versus my 3-year diploma plus additional
Yeah.
training over the years, right? So it's a huge, huge difference. A lot of the times masseuses also don't actually hold insurance, which is
Oh my God.
scary.
Especially when you're working again with pregnant ladies. Like it's
Exactly.
already a high risk situation. Don't
Totally.
make that worse. Okay. Well, why don't we kind of go into the main reasons that I wanted to chat about regarding prenatal massage, and basically how it can help make pregnancy easier on the body and the babe. So the first one I wanted to chat about was round ligament pain. So I personally feel this is just a very generalized term when you're pregnant for any possible pain you may feel is round ligament pain.
Yes, the term is thrown around a lot.
Yeah. So do you want to give us a bit of an overview of what round ligament pain kind of is and how massage therapy can help it?
Absolutely. So everybody's got a couple of round ligaments, one on your right side and one on your left side. And the round ligament actually goes down from the groin and the pelvis, and it attaches and wraps over onto the uterus. So when we're not pregnant, there's not much strain on it. It kind of just slowly contracts and relaxes, keeping things loose. Sometimes that can contribute to like period cramps. However, once you're growing a baby and the uterus is stretching, it puts a lot of added pressure on those ligaments. So instead of nice and slowly contracting and relaxing, any sudden and quick movements, so say you stand up too quick, or if baby moves too quickly, that can pull on that ligament and it will tighten up rather than slowly relaxing. And when it tightens, that can pull on nerve fibers, which causes that sharp pain and discomfort. So for some people, round ligament pain, it can feel really different. For some people, it might feel like that sharp pain, and for some people, it might feel like a crampy contraction. So it all depends on your body and your nerve fibers and what's going on. But that's basically what round ligament pain is. So it is kind of general, but it just means that one of your two ligaments that's stretching is kind of fighting back on the stretch that's happening, because it does stretch immensely. You can imagine not being pregnant, how that ligament sits versus having, a 3-month belly, and then right, as it grows. So it puts a lot of pressure on it, which is why it's very common that most people do experience some round ligament pain. So how massage therapy can help that is we're working out the tight round ligaments, which means not only is it relaxing them and teaching those tendons and ligaments to relax in the area, but it's also giving more room for baby, because when they're tensing up, they're trying to contract,
they're pulling everything
and it's putting
in.
that pressure on them. Exactly. So if we're able to keep them relaxed, it means there's more room for baby to move around, get into optimal position. Everything can just flow a lot better. So basically what we're doing when we do work for the round ligaments is getting the abdomen undraped. So towel over the chest, sheets tucked around the waist, super comfy, and then working through the abdomen and the baby bump. And then we're pretty much just kind of stripping through the ligament and putting pressure in certain pressure points to try and get it to relax. So sometimes it just needs that physical reminder of like, okay, we can relax here. This is okay. This is your new length. Everything is going to be okay. So this can help with that round ligament pain, with baby having more room. You can probably feel like you can breathe better because when the round ligaments are contracted, it tightens the belly and pushes everything kind of in and up. So it can put that pressure on the diaphragm and the lungs and make breathing tough. So round ligament massage can help with that as well. Of course, then it can decrease any Braxton Hicks contractions that are coming up. So massage is awesome for that. And then there's also the options of doing some kin tape to help take pressure off the round ligaments. With that, we're essentially trying to lift the skin up and off the ligament so that the nerve fibers aren't triggering. So that's a great option for people that experience a lot of round ligament pain because kin tape will stay on for anywhere from 2 to 5 days. So you can get that continued relief and support.
Taking a mini break here to chat about one of our sponsors. I never really considered what I put on my body in terms of lotions and potions until I was struggling to get pregnant. Actually, it was my holistic nutritionist who told me that I should check into my skincare products and see what ingredients were in them. And I was mildly alarmed at how many came back to disrupt hormones. This alone is one of the things that made me start making my own products. However, now as a busy mom, I don't always have time to make my own stuff, and some things I simply fail at, deodorant and shampoo being the biggest issues. I knew once I had my babes that I wanted to make their products too to reduce their chemical exposure, but again, sometimes it just doesn't happen, which is why I now rely on brands like Primally Pure to help me out. I may not be able to make everything, but that doesn't mean I don't want a natural product, and that includes eliminating the word fragrance in the ingredient list. Primally Pure products are made using simple, natural ingredients, and they work. Seriously, their deodorant smells amazing. Everyone, especially my husband, are thankful. Plus, their prices are practical. A tube of deodorant is only $16, and using code MAMABEAR10, you can even save money on that. In my one quest for deodorant, I spent $24 on just one tube. How messed up is that? Primally Pure products are safe, all natural, and perfect for busy moms who just don't have the time or want to make their own. They're chemical-free, they're all organic, and they work. For listeners of this podcast, Primally Pure is giving 10% off your first order if you use the code MAMABEAR10. Now, it's funny because I always thought of more round ligament pain in the early trimesters.
Mm-hmm.
But it would, and that's I think where I experienced it the most, but it would be probably the opposite for the majority of females, is as the baby grows, it's placing more strain on.
Correct. Yeah. So especially with a first pregnancy, most people do experience more round ligament pain the farther into pregnancy that they get. However, I would say with subsequent pregnancies, people feel it a lot more earlier on. And I think that's also because people can recognize what the pain is and remember how it feels.
And your body recognizes too, right? So it tries to expand a lot sooner.
Yes, exactly. So
that makes more sense.
Yeah.
Oh, yeah. Round ligament pain's not fun.
No.
One of my girlfriends works in the ER, and she said that it's one of the number one reasons that pregnant ladies come into ER is because they think that they're miscarrying because of the cramps or the stabbing pain.
Yeah.
When it's really just a growth happening and then triggering a lot of round ligament pain.
Mm-hmm. Yeah, it can be really, really scary. Or people can think they're going into like early labor. Like it's no joke. And a lot of people, I think, like write it off as being like, oh, that's just a little round ligament pain or a Braxton Hicks contraction. And it's like, nope, that's a very real and intense pain for a lot of people.
And it is intense. I think people forget that with pregnancy because being pregnant is just, you're pregnant. But no, a lot of changes happen. It's very uncomfortable. It's not awesome.
I know. Some people, everyone's like, oh, the miracle of life. And I'm like, talk to my clients. Pregnancy sucks.
Yep.
It's okay to admit that it's not always awesome.
That was me. I was like, kudos to anyone who enjoys being pregnant. It is just not my favorite place to be.
Yep.
Okay, so on that note of uncomfortableness, talk to me about sciatica. So this is another really, really common issue while you're pregnant, and one that causes a lot of pain to females.
So sciatica is, again, it's kind of one of those general terms. There's a few ways that it can happen. So for anybody listening that's not familiar, a sciatic pain typically starts from around your tailbone and goes through the glutes and the butt cheek and down the leg. So for some pregnant people, they might experience this as only staying local to the glutes. Some people will feel it shoot all the way down. It totally depends how much compression there is. So sciatica is compression of that sciatic nerve. So typically what's doing this is our piriformis muscle, because as I know, piriformis massage does not ever feel super fabulous, but afterwards it feels fabulous. But why this typically happens is because as you're growing your belly, not only are ligaments changing and relaxing in the pelvis and spreading things open, but typically as the bump grows bigger, our center of gravity changes, we start to arch our back when we walk, and the feet start to turn out. So it's when you get that little duck walk that things get risky for developing sciatica. And that's because you imagine your feet are straight out in front of you. And if you turn your feet out so you're looking like a ballerina, and kind of just put your hand on your butt cheek there and feel how everything tightens up. So as we're doing that external rotation there, it's contracting our piriformis muscle. So it's like you can imagine if your neck was always kinked to one side, right? That side is just going to get tighter and tighter, and you're probably going to experience some numbness and tingling. And that's what's happening essentially with the glutes, is they're tightening up from that duck waddle, and then the sciatic nerve that's going through the piriformis muscle kind of gets a bear squeeze on it. And it doesn't want to let go unless we're actively working it out, stretching, foam rolling it, and trying to correct the posture of how you're walking. So it's much easier to prevent sciatica than it is to treat it. It is super treatable while pregnant, but it's something you have to stay consistent with. Typically, once you develop sciatic pain during pregnancy, it's going to kind of have flare-ups for the rest of pregnancy, and sometimes beyond. So if you're pregnant and you're listening to this, do some piriformis stretches, foam roll out your glutes.
Yes.
Don't get to that space. But massage is basically working to lengthen and elongate that piriformis muscle to take pressure off of the sciatic nerve. So what we want to do is just get it back to that relaxed state, get some length going in it again, and so that it's relaxed and not putting that pressure right on the sciatic nerve, which is causing that. It can be like sharp shooting pains down the leg. Some people, it'll give them like numbness, and they'll kind of feel like they get up and then they're going to fall over and their leg's just going to give out. So massage can definitely have that, working through like the SI joint, trying to release some of those ligaments in the posterior chain of fascia. It's all connected, right? Can also help. And then being diligent with stretches at home, like is also very important. But a lot of people, I'd say, like the number one complaint of pregnant people that come in is either sciatic pain or low back pain of some sort. So it can be very helpful. It's just staying consistent. My rule of thumb, and I know a lot of other RMTs that work in the prenatal field's rule of thumb, is you should be getting a massage as often as you're seeing your OB or midwife. So in the beginning phases of pregnancy, a little bit less, but as you get more pregnant, maybe it's every 2 weeks, and in that last month, every week, just to really stay on top of things, because things change a lot quicker the more pregnant that you get. So you might not experience sciatica for the majority of your pregnancy, and then at the very end be like, oh crap, what is this sharp shooting pain that's making me want to cut off my legs?
And it really is terrible. Now, I was lucky enough not to have it too badly. And I think, in truthfulness, because I am a really big foam roller. Mm-hmm. And the other thing is that I see an osteopath during pregnancy too. So she kind of helps set things where they should be, because yes. I do typically tend to jam my SI joint all the time, yeah. Which gets annoying. But yeah, sciatica pain is, I think, probably the second reason pregnant ladies feel discomfort. I'd say the first is definitely low back pain. And I'd say it's a bit of a conundrum, because for low back pain, you do want to keep the glutes strong to help support the hips widening and to help support the baby bump. But with strong glutes, you also want to keep your hips mobile so that they're not impinging on the sciatic nerve. So I think
it's a big balancing game.
Yeah. I think it just goes hand in hand, and it's something that you have to focus on both sides in order to have the least amount of pain.
Totally.
This is the best way I can explain it. And then I also wanted to chat about swelling. So this was one of the reasons that my girlfriend started seeing her RMT while she was pregnant. She was having twins. So there's that.
Oh.
But she was also having a really, really wicked time with swelling of her lower body. And in my experience, massage therapy has always helped with that because it improves a little bit of circulation. So I'm assuming you see a lot of prenatal clients who are hoping to reduce a bit of swelling pain.
Yes, totally. And I always like to remind everyone too, it's good to have a little bit of swelling. That extra fluid is kind of helping the body to soften and expand. So it's normal to have a bit of swelling. But when we get that edema, it is nice to come for a massage and try and work everything out. And there's so many things that can affect swelling, right? Whether it's hormones or the growing uterus, like everything is just, everything is changing. So there's a technique called MLD, which is manual lymphatic drainage, that I believe we're all trained in school. I'm not sure if that was a Fanshawe specialty, but it's exactly what it sounds like. So we're manually pumping the lymphatic system, which is where we get our swelling, to return everything to the heart. So manual lymphatic drainage and cupping actually are what I like to use on pregnant people to help with that swelling in the ankles. And I would say, just for everyone that's listening, cupping when you're pregnant is very different from cupping when you are not pregnant.
I'm really glad you touched on that, because I was thinking of regular cupping when I had it. I was like, oh my God.
No, you wouldn't be leaving with the big red circles. It's very gentle cupping. So it's almost more of a suction cup rather than if you've had cupping before, like the pumping, or whether it's, So it's very gentle. But with both of them, it's very gentle techniques to try and move that fluid back up and encourage the body to open the watersheds, which is basically our main hubs of our lymph nodes and where the lymph is flowing through, to get everything pumping back up. Because especially in the pelvic region, as things are growing, it puts pressure on these like lymph nodes, and then makes it hard for the body to pump it back up. Same with circulation, which is why people get a lot of the varicose veins in their legs and the little spider veins, because it's just a lot harder when you're pregnant to get that venous return and lymphatic return for everything to go back up. So what we're doing really is like just manually kind of trying to fit back up. We know where the watersheds are, so kind of like opening those up to get everything just flowing nicely back to the heart. Yes. So a lot of people as well experience the swelling in the face. So massage and facial cupping can help with that, to help drain everything. So people that do get the swelling in the face can sometimes find they have like chronic sinus congestion during pregnancy as well, which massage can help drain and move everything out, which is really nice. The other thing that I recommend to like every pregnant person is compression socks. I'm a certified compression fitter. There are a lot of RMTs that are, chiropractors that are, but the compression socks are just helping to physically pump that lymphatic fluid and circulation back up to the heart. So if you're someone, even just in general, that experiences a lot of swelling or achy legs, a lot of women just get that kind of restless legs because of our hormones and our lack of magnesium a lot of the times.
Oh, don't get me started on the rant of magnesium. We use a sleepy time spray before bed.
Yeah.
And every so often we'll throw some in our shakes just to bump that up a little bit.
Totally. So massage and compression, everything, it just helps to kind of move everything back up. The dry brushing, trying to decrease salt and caffeine intake for pregnant people that have a lot of swelling, because that just contributes to it. So there is a lot that can be done to help manage the swelling. Of course, if you're third trimester in the summer, you're probably going to have a harder go at things. But
I was just going to say, I never used compression socks because both of my girls were due September 6th.
Yeah.
And so I get to be pregnant all summer long, and like
it's tough.
Pregnant. And so compression socks were never ever something that I kind of rocked to.
Totally.
But I've heard my girlfriend did use them. She said they did work wonders. And so did getting a massage, though, just because it honestly just helps get everything moving. Again, she was having twins, so there's a lot more going on there.
Yeah.
But the socks helped immensely. So I wouldn't have thought of that. That's a really good tip.
Yeah.
So we've talked a lot about the benefits to reducing pain for mamas, because let's be honest, pregnancy is not always the epitome of awesome. Let's quickly touch on the benefits of massage for the baby. So what's in it for the baby?
Yeah, so there's actually been some really interesting studies done. So when I say benefits to the baby, this is mostly coming from having regular abdominal massage while pregnant. So I always like to try and encourage people to try it at least once and let me work my magic. And then there's some little techniques I can show people to do at home as well, because it's nice for people to bond with the baby. But studies have shown that people who receive abdominal massage during pregnancy, it helps to calm the stressed baby. So,
and that just sounds like it would feel amazing, to be perfectly honest.
Yes.
To have someone massage this big, like crazy tightening belly.
Exactly. I don't think I've ever had one complaint about it. People tend to love it. It helps you breathe better. But there was another study done that showed that babies who received like massage while they were in the womb from the belly had better APGAR scores when they were born. So
that's
healthier babies. Yeah. So I thought that was super, super interesting. And of course, with the massage, we're increasing circulation and fluid flow to the baby. So it decreases some risks as well during labor and delivery, because there's just more adequate flow happening through the placenta to the baby.
And more nutrients, I would think, too. Like they'd
Exactly.
be able to uptake nutrients if you're increasing the volume of flow.
Yeah, so it's very, very interesting. And as well, for some people who maybe they have the like anterior placenta, they might not be able to feel baby as much. So the abdominal massage, usually it gets them like kind of kicking a little bit, because they're like, whoa, what are you doing in my space? So it can be nice for people as well to kind of have that connection with baby and for baby to feel them, right? So it is nice and just kind of helps relax baby, because there's not much that you can do to kind of connect with baby physically while they're in the womb.
Yeah.
And it's
aside
so
from
close.
Poke them. I totally poked
Exactly.
mine. Mainly because they would hit back wherever I was poking, so it was kind of fun.
Yes.
It wasn't just a mean
I have been kicked and head bedded by babies through wombs. I have felt it all.
That's awesome, though. Those are my favorite parts. The kicking was always my favorite part of being pregnant. Always.
Yeah, it's so special.
And so you mentioned you'd recommend women, if it's possible, to go about once a week towards the end of their pregnancy for a prenatal massage, right?
Yes, yeah.
Okay. And how long are the massages?
I usually recommend at least 45 minutes.
Okay.
So it kind of depends what's going on. I say typically I like to see people for an hour. I always say it depends on, financially what you're able to do.
Yeah.
Ideally an hour. And that's because with me, for a typical prenatal massage, I'm always going to want to hit legs and feet on everybody. And that's again, just because of swelling, venous return. I want to get everything pumping back up. So having, that extra 10, 15 minutes to work through that on everybody is just really nice, right? Like I kind of, you don't fall into a routine. Everybody's different, but there's those key things on every pregnant person that as an RMT, I want to make sure I'm not neglecting.
Yeah. There's spots that are always going to need more attention.
Yeah.
And now, have you ever had anyone fall asleep during their pregnancy massage?
Oh, all the time. I've had people fall asleep during prenatal massage. I've had last week a mucus plug came out during prenatal
Oh my God,
massage.
really?
Yeah.
That's hilarious. I
So
didn't
it's
even
good.
think of
People
having
are
to deal with all that.
relaxing. Oh yeah.
Oh, that's fun. I used to be the person that fell asleep during massages until I switched to getting sports specific massages, and you cannot fall asleep during those.
That's very true.
But my pregnancy massages were pretty awesome.
Exactly.
They really do just make you feel amazing.
Yeah, and it's a nice balance of both relaxation and therapeutic work, right? Because with pregnancy massage, it's important that we're not stressing the nervous system, which is why we don't do like that deep, deep work. Because if that's stressing the nervous system, the body says, okay, we need to bring attention to, say, this shoulder knot, rather than we need to bring attention to the growing baby. So that's
Okay.
why it's a kind of a careful mix during pregnancy massages of, of course, like with areas of the low back, we're not going to use a ton of pressure just because of the baby that's on the other side of things in there. But it's still okay to work deeper in the neck or other areas and just kind of have that balance of getting the deep work done, but then going back to our soothing and calming work that's going to help decrease that fight or flight response in the body. Because when the parent is in that rest and digest state, so is baby. And
Yeah.
that's ideal, especially for if you're wanting to get a baby out of there. If you're relaxed, baby's relaxed, things are going to move.
I still just can't believe that trying to induce babies is done all in the feet. That blew my mind.
Yeah.
I just didn't
Yeah.
realize
And
the triggers down there. Like that's kind of funny, but it also made sense as to why the old superstition of don't get a pedicure.
right.
A pedicure will make you go into labor, and I was like, that's why.
Yeah. And I always tell people too, it's not like there's like one magic button you press.
There
Otherwise,
is
there'd be a
not.
lineup out of our doors. But yeah, collectively stimulating those reflex points can really help.
Yeah, it was interesting. I found it really interesting.
And it's
But
relaxing. Who doesn't love having their feet
right?
massaged and pressed on?
It was kind of awesome. So one
Yeah.
last question before I let you go here. How did you come up with the name for your business? Because it is awesome. So for those of you who may not remember, because we've been chatting about a bunch of stuff, Victoria's business is the elephant in the womb. And it just, I don't know, I really love it.
It was a lot of brainstorming and kind of checking what URLs were available
Yep,
and
right?
what
It's
business
really
names were
hard.
taken. Yeah, so actually my original idea was going to be womb service, like room service, but with womb, which was taken. And then I came up with the elephant in the womb. And I was like, thank God I didn't go for womb service because the elephant in the womb is so much cuter. And I had Carissa, my reflexologist, she has an art degree and she designed my logo, which
Oh
is
my
like a
God.
little pregnant person with a little elephant in the belly, like the
That's
baby bump.
too stinking
And
cute.
it's just so cute. It all works so well. And yeah, I think my mom might have helped me a little bit. I remember some phone calls when I was in Windsor of being like, all right, we need to think of pregnancy puns.
Yeah, no, it was perfect when it was one of my girlfriends who sent me your way, and that was the first thing that just kind of captured my attention was it is a perfect name for what you do.
Yeah.
So nicely done.
Thank you.
Okay, so I think we're going to wrap it up there. So first off, Victoria, thank you so much for coming on here today and chatting about all the awesomeness of massage, as if we needed more reasons. I'm telling you, I am very excited to have mine in a couple of days. So if you want to connect with Victoria, you can find her at www.theelephantinthewomb.net, as well as on her Facebook and Instagram at The Elephant in the Womb. And of course, I'm going to link to those in the show notes in case you have any further questions, or if you're local and want to book in for a massage. I personally, when people say them in podcasts, can still never manage to find them. I have to have the link to click. So just head to the show notes and you will have all of that information. So once again, I can't thank you all enough for listening. I'm loving having the ability to chat to so many amazing people about all the things I love. It truly is my dream job. So if you're enjoying what you're listening to, please subscribe, rate, and share the podcast. Not only does this give helpful information to others who may not know where to find it, but it also helps me out too so that I can keep providing you with more. And remember, if you're in need of fitness tips, workouts, and amazingly healthy recipes, check out my website at www.fitasmamabear.com. On that note, check back soon for the next episode of the Fit as a Mama Bear podcast. And if you took one lesson from today's podcast, I truly hope that it's to book in for a massage, pregnant or not. Chat soon, friends.